just have one other question. So we just voted this past week on a menthol ban in Westchester County, and it's made through the health department. So with 30 inspectors and 4 vacancies, is that enough to enforce the law? Like to make
Well,
sure
I
that...
haven't seen the law yet, so I couldn't really comment on it at this time. I'd need to, be able to take a look at. We need to review it and see. But so I don't know exactly, how much we're expecting it to impact us at this point. I haven't seen the final version.
Okay. All right. Thank you.
But yeah, and in addition, I do want to mention that we did hire a new deputy commissioner, Chris Ericson, who his responsibility is environmental, and so he is being housed in the Mount Kisco office, and we're very happy that he has joined us. He came to us from Orange County and has a tremendous amount of experience, and so we're very thrilled to have him join us.
And I'm sorry. So the reason why I bring it up is we have 44 municipalities and a number of stores that sell the products now. So I just want to,
I anticipate that, we're probably going to need more help to, to make sure that we do what we're supposed to do in regard to this. But we're going to have to take a look at it, and I'll have to get back to you on that. I'm just not prepared to give you a number today.
No problem. Thank you. And the reason why I bring it up is because if we don't have the right workforce, but overtime rates are going to have to go up then.
Yeah.
So we have to take that into consideration with the budget. I don't know if it's something that will go up this year or, next year, but that was just, something that, maybe we should consider with that because of the workforce. So, if like I said, whenever you have a chance.
Yeah, I mean, the sanitarians really have been incredibly busy year.
Sorry. I was
just going to jump in for Dr. Amler. I had spoke with Chris about this, and I had spoke with the legislature when you guys were proposing this, and I know Chris had some input in this also. And one of the things Chris did say is, like anything else with new legislation, and depending on how many facilities, if we're going to be going in there, it is going to be additional staffing. It's just, right now, even with the staffing we have, when looking at our responsibility for lead-based paint inspections, restaurant inspections, and everything else under the sun that we do, we need to train up people, and we're going to need additional staff to be able to do that kind of work. And, it's been our HR department has done a great job. Renee's done a great job, Dr. A, and I applaud the county executive and his staff on giving us the opportunity to get these positions, but it's actually finding people to fill them. So it's advertising and working. As we said, we have, 5 or 6 potential sanitarian vacancies in general. We got to get them filled and then get them spooled up, and we're probably going to need additional sanitarians.
Yeah, I anticipate we will need more. I just can't give you a number.
Okay.
And, I think one of the issues that we have is with sanitarians, there's no school where you learn to be a sanitarian. It's on the job training. And it does take a while to get these people up where they feel comfortable inspecting restaurants, complaints, summer camps, all the many programs that they do. And they have a very diverse thing. I mean, when a lot of our staff, they have one set of jobs and they learn that, and that's all they need to know. With the sanitarian, it is such a huge dichotomy of responsibilities, everything from, like I said, restaurants, summer camps, lead, complaints, there's just a lot of different, and they're very different programs. And so it does take a while to get these people up and really able to do the job across the board. So.
Take the liberty of jumping in. I understand there's other questions from others, but was there a commensurate uptick when flavor the jewels were banned? And I heard you say that, or maybe it was Peter say that there was going to be different establishments reviewed. Is there a separate review for each individual restriction, underage smoking, flavored tobacco, flavored jewels, for example, or is it the same visit to establishments? And then I guess the related question is, Are there extra establishments where flavored tobacco would be sold where these other checks wouldn't be conducted?
Yes, and yes, there's a lot of different potentials out there. I mean, we try to do them in one inspection. We have our ATUPA program, which is our Adolescent Tobacco Use Prevention Act. So we have our inspectors that are checking for compliance to make sure there's no underage sales to minors. But during that inspection, or if we don't have a minor to go out that day or that evening, we'll go and just do to see if they're selling the flavored vapes and things like that. Now with the menthol ban, and once again, I'm going to have to review that, specifically to see how that got passed. I mean, what is actually in there? We might have to do separate inspections for that. I'm not sure. Because another problem was the online sales and being able to have product in the store, and they would have it in the back, but if we would do an inspection trying to purchase, suddenly it was available for us to purchase, even though they're saying, we only sell it online. We sell it, in other districts where we can sell this. So it's a difficult inspection.
And, we may need to look to identifying other youth to be involved in this program, which is great. I mean, I think the kids really enjoy being involved in this program. And I don't know if you want to speak to the ATUPA, so that everyone really knows what you're talking about, Pete, with the ATUPA program.
So basically, thank you, Doctor. Basically, we hire youth, and now it's under 21, so 20 and under, to go out with our inspectors and to potentially try to attempt to buy a tobacco product, whether it be a vape that has nicotine, or a nicotine product, or actual traditional cigar. If they sell to the minor, our inspector, writes a summons. If they don't sell to the minor, we congratulate them. And, we go through periodically all of the stores on the list multiple times a year. And that's one of our requirements to do for the state for running this program. In addition to that, those same inspectors would do just the flavored vape checks and whatever other legislation that we have in this case with the new legislation for the menthol. We would work on that. We try to train up all of our inspectors at some point to have an idea how to do this, but we did have specific inspectors that do these inspections, but actually one of them retired at the end of the summer, and the other person is retiring actually today. But we do have an inspector that is aware of how to run the program, and we do have other inspectors that have been trained up, but it's an ongoing cycle.
No, the inspections, are they only done off of, being reported of, they have this product, or is it just done?
No, it's just, they have a list.
Okay.
A list of all
But
the
if we get
registered-
somebody that they're saying to us is selling to minors, we certainly would immediately go and send someone out there.
I think Ed Brancotti, who's sitting right there next to you, we've worked with him with Mount Kisco, and we've been very successful, dealing with that on a complaint basis and doing joint inspections actually with the police department, because we will, in those cases where we're really seeing issues, we'll work together as a team, and we could write the violation for the sale, and then the police could write the endangerment to a minor. I think Ed may want to speak to that because we've had an intimate relation, and it works really, really well.
It has, and it's look, it's a benefit for us in the village, having our shared services agreement with the county for the provision of police services. So it's a unique situation that doesn't necessarily exist everywhere else, but there was an opportunity for that overlap, right? So that the health department could work with public safety and our folks, and we could do this jointly and together. As we got in Village Hall, we would get complaints, right, from residents that with this store, my kid went in here. We then coordinated, so I would work with John Hopper, with Pete, with the county police, and we were able to do that, and it's been effective. You don't have that everywhere, but the health department does work, as they said, to go through randomly, but certainly when they get a complaint or something's brought to their attention, that'll just bring that establishment
To the top of the list.
So.
I was just curious because I couldn't even imagine how many stores in Westchester it's going to impact now. So the number of inspectors definitely have to be a lot higher than 30.
I'm sure.
And, just the expense alone to try and see if it's even possible to implement, because the last thing you want to see is take a toll on anybody's department, and it's something that pretty sure that we're all gonna be inquiring about with the staffing and stuff like that in the budget. Also with, overtime rates, just to see how it's going. Because, it's gonna have a financial impact on Westchester County.
Look, having been on the Board of Health now for, 11, 12 years, and I think Legislator Gashi brought up a good point, and Pete knows this. We've been inspecting, there's a lot of overlap. We're already inspecting these facilities, these businesses, and have been from a tuba standpoint. When the vape was added, and the flavored tobacco was added, it's just, okay, it's another thing that gets added into that inspection. The menthol is gonna be another item. There are some distinctions, right, depending on how the law is written and what they're allowed to do or not do. And I think you heard that. So I think they'll do that. I think the department, I will tell you, and because now as this opportunity, the Board of Health fully supports the department and this request. I think what has impressed us every year, and when you look at the budget, people see the health department, they see a big number, right? 170. The bulk of that, though, as you can see, is children with special needs, which is important and an absolutely critical part of what the department does. But then when you realize that everything else the department does is in that 25 million for 1 million people, right? So it is all of these inspections on tobacco. It is dealing with infectious disease, controlling COVID and pandemics and Ebola and monkeypox. It is the inspections of all of the food services and permitting them. It is, we're doing West Nile, which we dialed back from. But it's the camps, it's the pool inspections, it is the nursing, it is the vaccinations, it is the shelters, it's communicable diseases, it's the doctors, it's the nurses. It is also important, the engineering staff, all of the review of all of the municipal water and sewer infrastructure and our public health requirements there. Particularly with the infrastructure dollars that are coming from the federal government, that are coming from Albany, as so many all the municipalities are working on, rehabbing 100-year-old public water and public sewer systems, and it all has to be reviewed by the department and the engineers. So I think the volume of work that is being done by this department on a daily, weekly, monthly, annual basis, on top of the response to once in a century pandemic, is incredible, is admirable, and for the amount of money is the department, I think, the board feels, look, staffing is a challenge. Staffing, it continues to be a challenge, not only the request for new positions, but challenges filling the already existing vacant ones, or the ones that are becoming vacant because people have reached the end of a long, well-deserved career towards retirement, or they're just maybe burned out a little bit, which is understandable. I think one of the challenges you'll see in here is that the board is looking to see if we can, review on the salaries and make sure that for some of these positions, the physicians that have been hard to fill, not that we're comparable with the private sector, that's never going to happen, but we need to be competitive with our other comparable municipalities, Nassau County, Montgomery County, outside of DC, Fairfax County, Miami-Dade, Cook County, the similar suburban metropolitan communities around the country that are similar to Westchester County. But those are the communities we need to be competitive with from a salary standpoint in order to continue to attract and retain the talented, dedicated, public health servants and officials that we need. The million people that